I'm actually going to turn it over to Aaron Mallett, who is one of our students in the online MPH program in the Global Health track. And Aaron has traveled with me and my colleague, Dr. Withers. We teach a course in Costa Rica on health and sustainable development, which is open to both online and on-campus students to learn about health and sustainable development in what better place in Costa Rica. It's a 2-week course. It's kind of a unique feature of our online MPH program. It's an optional course for students to take if they would like to. It can satisfy an elective in addition to the fully online courses that we offer through the program. And one more note. So this series, having the Student Spotlight series, was really inspired by the great work of our students. Our students are doing amazing practicum work around the world, great jobs around the world, and we really love hearing from them and what they're doing. And this was inspired by their amazing work. So today I'm happy to have Aaron Mallett, who's agreed to join us and share with us what he's doing in Costa Rica.
Amazing. Thank you so much. Thank you so much, Dr. Kumar. Hello, everybody. Before we get into it, I'll kind of give you a little bit of the lay of the land of where I am right now. So I just finished up my 6-week practicum in the south of Costa Rica in a little town called San Vito, which is in the Canton of Corredores, very close to Panama. And right now, I am in the city of Jaco, which is about an hour and a half outside of San Jose. I'm enjoying a little bit of beach time before I head back home to Canada on Saturday. So without further ado, let's get into it. So before I tell you what I'm doing here in Costa Rica, I figured I'd tell you a little bit about who I am. So I was born and raised in Waterloo, Ontario. I am a tried and true Canadian. I have a Bachelor's of Science in Biology and Medical Sciences and a Certificate of Business French, which I got both from the University of Western Ontario. And as Dr. Kumar mentioned, I am currently doing my MPH in the Global Health concentration, but I'm also taking a Master's of Science in Global Health Policy through distance learning from the London School of Hygiene and Tropical Medicine, and I hope to finish that either this year or within the next 2 years. And when I'm not doing that, I'm an avid traveler. I've been to about 40 countries. I'm a photographer, and I also enjoy napping because, honestly, who doesn't? So what am I doing in Costa Rica? Like Dr. Kumar mentioned, I traveled with Dr. Kumar and Dr. Withers to Costa Rica to take the Health and Sustainable Development course, PM 599. And after that 2-week course was done, I completed a 6-week practicum with the Interamerican Centre for Global Health, which in Spanish is called el Centro Interamericano de Salud Global, and that's the acronym you see on the slide there. And we also worked with the Costa Rican Ministry of Health. My project was systematizing, which is a really cool concept that's quite common in Latin America, which seeks to look at the experiences of actors and put them together in a systemic formula so that people can better understand complex practices, as well as analyzing the Red Cantonal de Actividad Física y Salud, or Rican, which in English translates to the Cantonal Network of Physical Activity for Health. And what that looks like is, I'll get into a little bit later, but it's a group of 10 or so different actors that work within each canton or administrative subdivision of Costa Rica to host events that promote physical activity and health. When I wasn't doing that, I also did weekend work with Hands for Health, which is an organization that aims to improve the health of indigenous people and children in the Brunca region, so the southern region of Costa Rica. So before I talk about my practicum, I'll talk a little bit about the course. So PM 599, or Health and Sustainable Development in Costa Rica, is a 2-week intensive course from 7 a.m. to 7 p.m. We are out, we are doing things, and it's wonderful. It's a collaborative course between USC, so Dr. Withers and Dr. Kumar, as well as CISG, who I mentioned earlier. And it pairs daily site visits with lectures throughout the country. So the way our course worked was we were in San Jose for a few days, learning about health and human rights. So for those lectures, we visited the National Women's Prison as well as the Interamerican Court of Human Rights. And then we traveled south to San Vito, actually, where I did my practicum. And we talked a lot about culture and health and what culturally competent healthcare looks like, and we visited an indigenous community. And then after that, we traveled to the Osa Peninsula, which is a smaller region on the west coast of Costa Rica, where we talked about planetary health and sustainable development. So my favorite part of this course was the ability to connect what I learned in the classroom through the MPH, the online MPH program, to the real world, and taking concepts and constructs that I had only kind of learned about from our textbooks and seeing them applied in real life. So for me, what really struck home was the concepts that we talked about in PM 525, which is culture and health. And a great example is what you see on the slide there. So what you see on the slide is the building for the IBAIS, and in Costa Rica, an IBAIS is what's known as a Equipo Básico de Atención Integral en Salud, which is a team of 5 different medical professionals. So there's a doctor, a nurse, a community health worker, a medical records clerk, and a pharmacist. And these 5 people make up the equipo, and they are housed in buildings all throughout Costa Rica. And the one that you see on the slide there is the IBAIS building in La Casona, which is on indigenous territory here in Costa Rica. Now, it looks a little bit different from traditional IBAISes, which are just kind of general office buildings, because it was actually designed with the community, and they came together and they wanted to have their needs met in the building. So the building actually is designed around concepts of traditional living styles, and it's decorated, it's very hard to see, with triangles, which are a very important symbol for the Nobebule, which are the indigenous population, because for them, triangles are seen as a form of protection. And then also another concept we talked about in PM 525 was adapting our health promotion strategies. So it's kind of difficult to see, but on the slides there, you'll see 2 health promotion posters that were up in the IBAIS, and they look a little bit different from our traditional posters because the imagery that's on there heavily features people who are representative of the indigenous culture, as opposed to somebody that is representative of the traditional Costa Rican population. Now, outside of that, we also talked a lot about ethical development and ethics of global health experiences, which are concepts that we talked about in PM 568, which is global health ethics, which if you are in the global health track and haven't taken it yet and have the opportunity to do so, I highly recommend it. It was my absolute favorite course, but we'll get into why later. Also with PM 564, which is leadership in health, I believe, we met important local leaders in healthcare in Costa Rica. For example, we met with Dr. Pablo Ortiz, who is the leader of Hands for Health, and he's kind of, as Carlos and Carolina, who are the director and assistant director of the Center for Interamerican Global Health, like to say, he is the Costa Rican Paul Farmer. And finally, PM 565, which is global health, we learned a lot about the Costa Rican healthcare system, the way it's structured, the way it's financed, and problems that they're facing. So all in all, we took a bunch of different concepts from various different courses, and we got to see them applied in real life, which is pretty cool. Now, not only is there in-classroom learning, there's a lot of outside of the classroom learning as well. And this isn't something that I thought I would have when I came to Costa Rica, but I'm really, really grateful that I had this opportunity. So on the slides there, you'll see on the left-hand side are African palm oil trees, and in the middle are pineapples. Now, these are 2 things that I had kind of only vaguely heard about at home. Pineapples are my favorite fruit, so I knew a little bit more about those than I did about palm oil. But being here in Costa Rica and learning about the vast swaths of land that are being destroyed to create palm oil fields and pineapple fields, and the havoc that that's wreaking not only on the environment, but on the local farmers that used to use these plots of land for both subsistence farming and forestry, and how it's completely shifted their diet, has really kind of changed my perception of international industry, and it's changed me as a consumer. For example, I know that when I go home, I won't go to the grocery store and get pineapples, especially from Costa Rica, because what they do to mass farm pineapples here is they spray them with tons and tons of chemicals because they need to accelerate the ripening process from 2 years. And with all of these chemicals, they've shortened it down to about 3 to 6 months so that they're able to sustainably harvest them and make profits on them. So those weren't things that I expected to learn when I came here, but I'm really grateful that I have, because now I know ways that I can have an impact on global health, not through just my work, but through my daily choices. And finally, I put a picture of myself on the slide because the course has really kind of solidified my yearning to be a member of kind of the global health community and be a leader in the global health community. And so I learned a lot about myself and kind of where I want to go and what my research interests are. So I'm really, really grateful for that. So as I mentioned, PM 568, or Global Health Ethics, was my favorite course. And it's because I'd love to do my PhD in the ethics of global health experiences. So I thought it quite apt to talk about the ethical implications of what I'm doing here in Costa Rica. So primarily and most importantly, CISG, who runs the course, works in collaborations with their site visit partners. So instead of us or CISG going and saying, hey, we're going to do a site visit there on this day, they make sure that that site visit won't be an imposition on the community and the institution that's hosting us. And they build strong relationships with the communities and the institutions that are hosting us and ensure that we aren't an imposition on them. And most importantly, Carlos and Carolina, or whoever it is from CISG, isn't actually leading the site visits. Those who are a member of the community or are the institution who have that firsthand experience are those that lead the site visits and help us to understand what's happening. And a great example of site visits not becoming an imposition on the community is when we visited the National Women's Prison. The tour guide that we had that day kept offering for us to go and visit the private cells of the women and see what the housing conditions were like. But Carolina said, absolutely not. Like, that's not why we're here. We're here to learn about your programs and especially your health programs. And so it's not right for us to go and visit and see those conditions. And I really, really appreciated that. But outside of what CISG does, Dr. Withers and Dr. Kumar do a really great job of preparing students to come to Costa Rica and understand the local context through intensive course preparation. We had pre-trip meetings, we did readings, and reflection is a really critical element of the course. And for me, reflection is important because it helps us to understand our own beliefs and values, and that we can use that to prevent ethical quandaries. And it helps us to critically interpret situations and understand them at a deeper level than we would have if we didn't have that reflection. And it can help us to understand the ethics and the power dynamics in situations that we wouldn't necessarily notice in the moment. So let's talk about my practicum. Like I said, there's two major aspects of my practicum. Like I said, there was my practicum project, which consisted of a report as well as a video. The weekend work with Hands for Health that you'll see in the middle there. And then we also did a few visits around the Brunca region in Costa Rica. So I have on the slide a picture of BLA, which is a location in the south of Costa Rica that is really naturally beautiful, and it's got a beautiful story of it as well. There's an association of women in the community who have come together with each other to work on coffee production, and they've started a really great business that was unfortunately mired by fire a few years back, but they've completely overcome that. And so before I move on from my kind of what I'm doing, I'd like to talk about how I set up my practicum. So what I did to set up my practicum was actually on the Costa Rica course website, which I believe is costarica.usc.edu, but Dr. Kumar can correct me if I'm wrong on that. They mention about the opportunity to complete your practicum after the course is done. So I reached out to Dr. Withers, who put me in contact with Carolina from CISG, the Interamerican Centre for Global Health. And then Carolina asked me a few questions. We met over Skype. And then she worked with her local partners to help to find me a project, and we went back and forth between the two of us. But it was a really collaborative process between CISG and the partners on the ground here in Costa Rica, which I'll talk about in a minute, to help to find me a project that really suited my needs. So like I said, I love ethics, so I wanted to talk about the ethical implications of this. It's really important that CISG works in collaboration with Practicum institutions and builds projects in response to the needs of the organizations that are hosting Practicum students. So, for example, the Ministry of Health in the Corredores region where I did my Practicum really needed to understand their activities and the processes that go into the Rede system so that they could show the Ministry of Health what they're doing and how they're doing it, and they can use that documentation to pass up the system. And additionally, I'm not doing the work of someone that's in the organization. So in my case, there was no one in the organization that could do the systematization and analysis of the project, so they needed me as an external body to come in and do that. So I wasn't taking work away from anybody in the organization, which I think is really important because this is sometimes something that we see with global health. And finally, CISG and the institutions work to ensure that the project results will actually be of use to the organization. So I didn't come and do a project that I did for the sake of doing a project. The results that I have are actually going to create concrete change within the organization. So that makes me quite happy to see. And finally, I didn't work outside of my scope of work. So like we've mentioned, I am in the global health track. And like I mentioned previously, I'm also doing a degree in policy. So I did a project that kind of used my policy skills and my global health understanding as opposed to something where I'm not trained in, which is really important because sometimes with global health experiences, we see people doing things that are outside of their scope of practice and their scope of work. And that can lead to some pretty gnarly ethical situations, for lack of a better word. So what's next for me? Currently, I'm working on a literature review with Dr. Kumar. We're looking at cost and benefit analysis of investments in childhood vision care. And like I mentioned, my next step is my PhD. So I'd love to do a few more publications before I start doing those applications. And then I would love to do my PhD in health policy and health systems research, focusing on health systems and health system strengthening and development, mostly through global health experiences and looking at the ethical implications of those and the implications of these global health experiences on health systems. So before we finish off here, being that this is my last semester or my last term in the online MPH, I thought I'd give you a few tips for success from an old veteran to hopefully help you be successful in the program. So my first tip, and the tip that I'll tell anyone, is that your first 2 semesters in the program aren't indicative of the rest of the program. For me, those were my 2 worst semesters, and as soon as I started getting into my track-specific courses, my grades shot up, I felt more engaged in the program, and it just overall turned out way better for me. That being said, if you do run into issues, your professors are always there to help. Reach out to them, send them an email, set up a time to call. They are more than happy to help you. Also, utilize all the supports available to you, whether they're academic, you've got your professors, we have academic advisors, we have our student support advisors. But for me, a big part of my support system is my family and my dog, so I put them there on the slide. That's actually a picture from commencement. And for me, I know when I tend to get stressed, I tend to isolate from everything. And it was really nice having them there, especially the dog, to always be like, hey, you know what, you can't ignore me. And finally, second last tip, don't forget to take care of yourself. It's really easy to get bogged down with the MPH, with work, with other projects that you have, but find something that lights your fire and do that, because that will help you not get burnt out. So I put 2 pictures there on the top. That's a trip that I was able to take with my family last summer. Like I mentioned, travel is my thing. It's what I love to do. So to have the opportunity with the online aspect of the program to go and take a trip with my family really, really was what I needed, and it helped me come back stronger for my next semester. And finally, take advantage of all the experiences available to you, both formal and informal. And if you can, join the Geneva or Costa Rica trips. I'm a little bit biased because I think the Costa Rica trip is the better out of the two of them. It's a great opportunity to meet other students and other professors, and the amount of informal experiences that you get with your professors and with your other students and with Carlos and Carolina from CISG and whoever else might be there. It's really great, and those are the experiences in this course that have shaped my views, not only on global health and healthcare, but also on politics and policy, and just open my vision and open my brain to so many other possibilities that I hadn't really thought of. And so those for me have been the best aspects of the trip. So I really want to thank everybody for coming and listening to me blabber on for the last 20 minutes, and I'm really looking forward to your questions.
Thank you very much, Aaron, for joining and sharing with us here today. So we'll run through some of the questions. I'll take note of a lot of, my name is Steve Gutierrez. I'm an enrollment advisor for the program here. So I'll kind of take note of questions, about applying and requirements and aspects like that I can reach out and address. But now we'll kind of take towards questions for Dr. Kumar and Aaron that are in this kind of realm of what we're discussing here today. So basic aspects, we do have a question here is towards the length of the program and aspects of internship and job placement aspects. And then as well that this person is from San Diego, and if there is any assistance in that area for those sort of opportunities. So Dr. Kumar, if you could talk a little bit towards the length of the program, internship, of course we have a practicum component here, and then the job placement aspect, please.
Sure. Let me start with the length of the program. So typically students complete the program, if they are full-time, they go for about 2 years. It's 6 semesters in total. Or we do have a fast-track option also for students to complete the program in 4 semesters, which is a little bit over a year. But that is offered only with a summer start date. And that really is not possible for students to work if they're going to do the fast-track program. But otherwise, typically students will complete the program over 2 years, where they are, most of our students, 75% of them are working full-time. The other 25% are usually working part-time during the 2 years. So that hopefully addresses the length of the program. The other questions are around internships and practicum. So I see that, I'm just trying to keep track. So in our program, we require that students complete a practicum, which is essentially an internship for about 300 hours in an agency where they're working on something related to public health. So students have the option to do that anywhere they would like, whether that's in their home city, it's at their own place of work where they currently have a job, but perhaps in a different department or working on a project that's not part of their daily job. Or if it's, you want to go somewhere else in the world, like Aaron is doing in Costa Rica, or you want to go, to Geneva, or somewhere in, Africa, Asia, South America. We have affiliation agreements with over 400 agencies all across the world, and that list is constantly growing, where students can go and do their practicum based on their interests. And if there's an agency where a student wants to do a practicum that's not already on our list, we certainly welcome those new agreements. And so it's really driven by student interest, and we, ideally students are using the practicum as an opportunity to land their next job. So perhaps they want to get exposure to a particular agency or a particular type of work within public health with transferable skill sets. And so usually they do the practicum towards the end of the program, and use that. A lot of our students have gotten future jobs out of that experience, and others have, risen up in their own workplaces as a result of, taking on new projects or working with new departments. So hopefully that answers the practicum and internship question. Was there a third question that I'm missing?
It was just pertaining to the job placement, or probably in our sense of our career services counselor.
Sure. So we do have a dedicated MPH career services counselor, where the counselor will meet with students, to go over their resumes, go over mock interviews. We host a job fair, usually in the springtime, and we are constantly sending out job opportunities through the Moodle system. So there is a lot of focus on presenting opportunities to students and connecting you with them through through the opportunities, through our network. I mean, the other informal ways, certainly talking to your faculty. A lot of us are very well connected in different spaces, both domestically and internationally. And so as you take the courses, you get to know your faculty. You're always welcome to talk to us about working at a particular institution where we may have a connection, in addition to the kind of formal, official career resources that exist.
Thank you, Dr. Kumar. And Aaron, for you, we had, did you take other courses during your Costa Rica trip? And overall, how did you manage your time?
So the way I structured my degree was I always knew that I was going to finish my practicum at the end. So I was lucky enough to not have to take other courses during my Costa Rica trip other than my capstone, which you'll learn a little bit more about. But luckily, my capstone project is quite similar to the work that I'm doing with that I did for my practicum. So I didn't have to take any other courses during the trip, which was nice. And in terms of time management, I was pretty much working 8 to 5 every day on the practicum. Carlos and Carolina worked with me pretty much the entire time that I was here, and she was helpful about keeping us on track with deadlines and things like that. But on a day-to-day basis, it was very much self-directed.
Great,
I hope
thank
that answers
you.
the question.
And I think it does, at least for myself. Now, how much of your day would you say, as they're asking here, was devoted to lecture, and how much to site visits on the trip?
So the site visits were usually about 2 to 3 hours, and then the lectures about the same. With outside of that 2 to 3 hours, there's always a little bit of travel time, which was nice because we would have reflections and discussions about that in the car. But it was pretty evenly split between lectures and site visits, and lectures were always kind of after the site visit to allow us to build on the theoretical aspects of things that we learned in the site visits.
Thank you. And I mean, as we have a question here from Sarah, do you feel speaking Spanish is a must for taking this course? Maybe for Aaron first and then Dr. Kumar as well.
I would say for the course, absolutely not. Now, Dr. Kumar might have a different answer than I. My Spanish, when I first got to Costa Rica, was quite rudimentary. I spoke a really terrible mix of, I called it Frespañol because I'm fluent in French, and when I would want to speak French or Spanish, French would come out. But for the practicum, it is quite an asset to be able to have a basic understanding of Spanish.
Yeah, I'll just add to that. So for the course, again, Spanish is not required by any means. It's great if you have a little bit of background in Spanish. It helps. But the faculty who are traveling with you speak Spanish. Our partners speak Spanish and English, so it's certainly not required. And then for the practicum, yeah, as Aaron mentioned, it's if you're going to be spending 4 to 6 weeks in country, definitely helps to know the language.
Thank you. And another question is we had here, should students note their interest in these types of trips when applying to the MPH Online Program? I can kind of field that one. It's not something you need to note outright, because what we expect for our students here in applying as being in the program, that there is so much development of where your interests lie, where you can take yourself, and also of the opportunities here. We focus on the annual trips in Costa Rica as well as Geneva, Switzerland, but there are also a lot of other opportunities that are out there that you are going to really be privy to as part of the program here. So it is, I think, really about keeping your options open and your ears up, asking those kinds of questions, what's coming along, and then all of the notifications that you're getting as a student here to really be able to take advantage of. It's always nice to talk about it in the beginning and always great to mention it in things like your personal statement, but it's not outright necessary. And then for Aaron, how did you decide on the global health track versus other tracks?
Oh, this one's For me, it's a pretty simple answer. I've always known since about the second year of my undergrad that I wanted to go into global health. I took a trip to Nepal back in the summer between my first and second year of undergrad, and I knew that after that trip I wanted to work in the global health sphere in one aspect or another. And so actually having that global health leadership in the global health track was one of the things that actually drew me to the MPH program. So it was a pretty easy decision for me.
Thank you. And for Dr. Kumar, I think you touched on this a little bit, but is one of the questions here is what other travel opportunities are available, and can practicums be set up anywhere in the world? Again, I think you did touch on that outright, but is there anything you could expound on that?
Sure. So in terms of formal immersion courses, we have the Costa Rica course, which is 2 weeks, and then a course in Geneva on global health policy and governance, which is also 2 weeks. Both of those courses are offered in the summer semester. But as I mentioned previously, there are opportunities for students to travel individually for their practicum anywhere in the world. And since our faculty, particularly our global health faculty, are really well connected, we can pretty much help you connect to an organization anywhere that you want to work. So you can certainly travel to those places on your own as an individual practicum.
Great. And I think as Dr. Kumar, as I come across multiple times, it's really that there are a lot of options and opportunities, the flexibility that you're able to have, that you can personalize these experiences to yourself and still have those opportunities. Just being able to work with the practicum coordinator ahead of time to get those set up, to get that approved. As a whole, we really want you to be able to personalize these experiences to your interest and your goals. With Aaron, as the question here is, the amount of time you're in Costa Rica enough to finish your project, and how did you determine to create the appropriate scope of work?
So, absolutely, the time that I am here is enough to finish my project. That was one of my biggest concerns when I was setting up my project with Carolina, was that it is a 300-hour requirement to do your practicum, and so I wanted to make sure that I would be here for the entire length of that. That being said, if that's not something that's feasible for you, Carolina was really, she's mentioned that she's worked with other students in the past that have only had 2 to 3 weeks to do the project. So that's always an opportunity as well. But for my case, it was definitely more than enough time to finish my project. And then the other part of that, how did I determine my scope of work? So for my scope of work, I was given a document by Carolina, which had which was very well defined in what I was doing and what was expected of me. So I was able to use that document to use my scope of work, to create my scope of work.
Thank you, Aaron. And as Paul, I believe you had asked here, and yes, I think we did have a little bit of a spotty connection with Aaron's webcam, as he is in Costa Rica. So internet can be a little bit spotty down there. So we tried to show the live feed with him there, but of course technology may have hampered us towards that. As our next question here, I believe towards Aaron, it sounds like you and Carolina really defined your role prior to the departure to Costa Rica. Do you have any tips as how to seek out possible practical opportunities with global supervisors?
Absolutely, yes, we definitely did. So one of the documents that Carolina and CISG gave me before I came to Costa Rica actually was a well-defined description of my practicum and what I would be doing. Now, in terms of seeking out global practicum opportunities, I would absolutely recommend CISG. But if Central America and Costa Rica is maybe not something that you're interested in, always look on I believe it's My Practicum tab on Moodle. There's a list of all of the agencies that are approved to work with USC, and on there are a bunch of global partners that you can always just send emails out to and ask what kind of opportunities they have coming up for prospective practicum students, as well as if there's any institutions that you might know of and that aren't on that list, but you have a connection there that could potentially turn into a practicum, we can always get that approved, as Dr. Kumar mentioned.
Thank you, Aaron. And I think we have a two-part kind of here. That the first part, I think, that if you could field, they are curious if you always knew from the beginning that you'd want to go to Costa Rica.
I would say no to that. Costa Rica was something I had seen in my first summer in the program, and I didn't really think about it. And then I got the email again this year, and I thought, that would be interesting. So it was kind of a spur-of-the-moment decision to apply for the trip, but I am incredibly happy and grateful that I did because it was an incredible experience.
Great. And Dr. Kumar, the second part of the question is, what next steps would we kind of recommend to start if someone hasn't started their first semester but does have a good idea of where they want to go for their practicum?
As far as next steps, I think it's fine if you have a good idea of what you want to explore. You may want to schedule an appointment with our practicum coordinator. Her name is Carolina Lopez, to start discussing with her and figuring out the paperwork, and in case we need to do an affiliation agreement, we could get that set up. We also have our practicum director, Dr. Jane Steinberg, who you can meet with to talk about in more detail in terms of what you're hoping to achieve through the practicum. So it's great if you already have an idea of what you may want to do. You can certainly start talking to the academic advisors and the faculty about proposing that and getting the paperwork and any affiliation agreements underway. So that way, when you are ready to start your practicum, you can start right away.
Thank you, Dr. Kumar. And another question here is, would it be possible to also pursue a DSW at the same time?
Well, you students are not allowed to be enrolled in a dual degree at USC at the same time, unless it's a specific dual degree program. So for instance, if you're doing your online MPH here, you wouldn't be able to do another degree at USC at the same time. However, we do have students who are doing their online MPH here and doing another degree elsewhere, just like Aaron is on the call. So that is a possibility as long as it's not at USC. But I would caution you to make sure that your workload is manageable because it is a full-time program.
Thank you, Dr. Kumar. And as well, another question here for you. Would this degree help position someone to work with agencies like the WHO, UN, or UNICEF?
Yes, absolutely. We've had several students actually who've done their practicum at all of those agencies and have landed jobs with them. And our faculty, Professors Gruskin, Ferguson, particularly both of those, are very well connected with UN agencies, including the WHO, the Bank, UNDP, UNAIDS, and several others. They do a lot of research collaborations and projects with them. So there's an opportunity to get involved with the faculty on the research projects and start building, your resume and your experience towards working with those agencies through research experiences, through the practicum, et cetera.
Thank you. And the next question here is for Aaron. They're asking, as a prospective applicant, did you work within the public health sector before applying to the MPH? And, what aspects would make for a strong applicant for the MPH program, which I can kind of address the second aspect?
So I didn't actually work within the public health sector before I started my MPH. I always knew that my next step after completing my undergraduate degree was to get my MPH, and so I applied to a bunch of schools in Canada and didn't get in, and then I saw this amazing program through USC and thought that that was a great next step for me, so I applied and was successful in that. But I think that the next step for me is to work within the public health sector and then hopefully back into academia later.
Great, thank you. And then the second part is that of what aspects would make a strong applicant for the MPH. Dr. Kumar, if you could address that.
Sure. So we require that students have a bachelor's degree from a regionally accredited institution. So certainly having a bachelor's degree, taking the GRE if it's required. Some folks are not required to take the GRE if they already have a previous master's or doctorate level degree. So that's kind of the basics in terms of being eligible for the program. And of course, writing a strong personal statement about why you're interested in the program and what your goals are. If students who have previous experience in public health or healthcare or other fields that are relatable, it's always helpful to have experience before you're going into a program. And then, whether it's professional, it's volunteer, or it's a combination of those, all of those make for strong candidacy in the program.
Thank you. And as well for you, Dr. Kumar, with the courses offered, is there guidance, to help someone choose courses that match their track? Yes,
absolutely. So we have a strong support staff, including we have a student services advisor who would help you select the courses that you need to take for the track. We also have an academic advisor who can help specifically with academic issues and tips for success. You also are assigned a faculty mentor when you enter the program, and that faculty mentor is available to discuss kind of big picture, like I think I want to do this for my career or for my practicum, or I'm not quite sure what direction to head. So there's a lot of faculty and staff support as far as advising in terms of classes, careers, et cetera.
Thank you, Dr. Kumar. And I see I do have a couple of questions from Araceli Catalan about applying, about tuition aspects of that. I would love to be able to cover that with you. I have taken note of that, Araceli, and I will reach out to you directly so we can kind of discuss those as directly about opportunities, about options, about timelines of things. So I'm not skipping over your questions, but I will definitely reach out to you directly to help you with that. And with Dr. Kumar, if you could, this question is asking, would you say that this program is more cooperative or competitive? I'm not sure if they're actually meaning towards applying or in itself.
Well, so the program is competitive as far as applying. In terms of cooperative, I mean, we certainly cooperate with our students and our faculty. We understand that our students have busy lives. Most of them, again, they're working jobs. They may have busy time with family, whether it's young children, it's elderly parents, whether it's life stuff with work or family, et cetera. So we certainly understand our student experience and work with them to progress them through the program. So I hope that answers your question, but if not, please feel free to type it out further.
And then is, Dr. Kumar, are there mature physicians that have had success in the program here in terms of changing career directions and finding opportunities in the public health sector?
Yeah, absolutely. That's a great question. We do have several physicians in our program, mature physicians as well as younger physicians, and they have changed career directions or potentially stayed in the same career but taken on more policy level work or more administrative level work, more leadership level work. And I'd be happy to put you in touch with some of them if you're interested in learning more about their experiences directly. We also have several surgeons in the program who are doing global surgery residencies, et cetera. So definitely a lot of folks in the medical field who are pursuing this degree, nurses as well.
Thank you, Dr. Kumar. And Dominique as well, I do see your question there as to opportunities in funding. And again, something I would be happy to address and reach out to you directly about to talk about those kinds of opportunities. Dr. Kumar, we did have clarification towards that question, that it was really in the tone of relationships between students, of being cooperative versus competitive.
Sure. I think our students tend to get along really well. It's actually something I'm really happy to see, that our students have developed solid relationships with each other and amongst their cohorts. Even though it's an online program, you wonder whether people are really going to be able to develop solid relationships, but it's kind of a beautiful thing because they do. We have a lot of group projects and a lot of opportunities for students to interact with each other, and it's pretty amazing because by the time they come to graduation, you see they all know each other. They're hanging out at each other's houses. They're going to parties together. Some of them travel together or travel to each other. So they certainly seem to have developed strong relationships and very cooperative relationships. And I'd actually like to ask Aaron for his experience, if he could share about this.
Absolutely. I would say that it's not competitive between students at all, at least with my experience. The majority of the projects that I have worked on have been absolutely incredible, and everyone is so friendly and engaging and always there to help you understand concepts and offer clarification if you need it. And even we've put together study groups and things like that. So I would say it's even less competitive than my undergraduate degree.
Thank you, Aaron and Dr. Kumar. The next, we have a couple of questions that are kind of similar to it. So one being, what is, Dr. Kumar, what is the ease of getting a competitive job in the administration and or policy market after the MPH degree, but as well blended with another question that is asking about job positions that are available in like hospital or clinical settings.
Sure, it's a great question again. So public health jobs are in high demand. Well, excuse me, let me say that. Public health graduates are in high demand. There's a shortage of public health workers, both globally and nationally. So there's certainly a lot of room for public health folks to work in the space, and it really depends on your interests and where you're located and what you want to do. And again, our faculty are kind of going to be your best resource. So if you're interested in policy, for instance, or health administration, you really want to talk to the faculty who are teaching in those subjects, who are well connected in those areas, and they're often able to help students. To put them in touch with folks working in that space, and also your students, the other students. So that's one of the beauties of the online MPH program, is that your cohort is made up of people from literally around the world, and certainly around the country, and a strong part of our population is in the LA area as well. So you can network with your students, with your peers, with your faculty, and of course through the career services to really help find that job that interests you. There are specific tracks you may want to consider if you have a targeted approach. For instance, if you want to go into administration or health policy, you probably want to do the health policy track. So it's about kind of tailoring the track that you do and making sure that you're in connection with your faculty and peers who are working in that space to really land that job. And I see another question, what kind of jobs, positions are available in the hospital or clinic setting? It really varies. So depending on if you already have a clinical background in another area, for instance, there's a lot of demand for public health nurses. Or if you're a physician with public health training, you may decide to go in hospital administration or patient education. So there's certainly a lot of types of jobs in healthcare settings. It just depends whether you have clinical background or not, and there's opportunities in both spaces. If you don't have clinical background, for instance, you may be interested in doing patient education kind of at the broad level, or policy setting, or looking at kind of operations flow and understanding how the hospital is working and is it serving its patients, or doing program evaluations. So there's lots of kind of opportunity in this space depending on, again, what interests you.
Thank you, Dr. Kumar. I think as we really start approaching that time here, if there were any final questions, please do feel free to type them in, or I can always reach out and address. You'll see my contact information here. If you do want to reach out to myself directly and any information about the program, applying to the program, I'll touch base with the two that I have here, Araceli and Dominique. I will reach out to you directly. But if there are any other questions in regards to that, please feel free to reach out to me. And it would look like, lastly, we have a great note, Aaron, for yourself. It looks like your dad has joined us and said, great job. I will agree with him. Thank you for really joining us here tonight from Costa Rica and taking the time to do this, as well as thank you, Dr. Kumar, and all of the attendees joining us here today. Please always feel free to reach out to myself. I can always make sure we're connecting you or getting you the right answers to any questions you might have or getting you the information you're looking for. Otherwise, again, thank you for joining us here tonight, and everybody have a great night.
Great. Thank you.